Hello everyone, we are the Group 2. The topic to be explained this time is how to be a good hemodialysis nurse. The members of the group are
I'm Steady. Hello, I'm Aurora. Hi, I'm Belle. Hello, I'm Daisy.
and me, I'm Wang.
Aurora. Hello, Daisy. What is hemodialysis? And what is the principle of hemodialysis and the importance of hemodialysis? Here are standard answers.
Hemodialysis is also commonly known as artificial kidney and dialysis, which is a kind of blood purification technology. It uses the principle of semi-permeable membrane through the diffusion, harmful the fluid and excess metabolic waste and excess electrolyte removed from the body, achieved the purpose of purifying blood and to achieve the purpose of cleansing water, electrolyte, and acid-base balances. Let me briefly talk about the principle of hemodialysis. Dialysis is a separation and purification technology that separates small molecules, diffusing into water or biofilm through a semi-permeable membrane. As shown in the picture on the right, the thickness of the semi-permeable membrane used in hemodialysis is 10 to 20 micromole, and the virgin percent on the membrane is 3 nanometers, so only small molecules with a molecular weight of less than 50 thousandths and some molecular substances in the part are allowed to pass. Very large molecular with a molecular weight of more than 35 thousandths, the substances cannot pass. Therefore, protein, viruses, bacteria, and blood cells are impermeable. Most of the urine component is water. To replace kidney, which feature kidneys, a large amount of water must be drained from the blood. Feature kidneys only can use osmotic pressure and filtration pressure to achieve the purpose of removing too much water. The hemodialysis device used as an artificial kidney has the above management functions so that the quality and quantity of blood can be adjusted to be close to a physiological state. The following is the importance of dialysis, commonly used for diseases such as acute or chronic renal failure, acute kidney injury, acute heart failure caused by vitamin overload, or fibrillation that is difficult to control by drugs. Dialysis is an extremely important treatment. Dialysis can prolong the survival time and improve the quality of life. Dialysis helps expose or remove toxic and harmful metabolic waste from the human body. Okay, this part of hemodialysis is over.
The requirement for the hemodialysis nurse is Aurora's answer.
Hemodialysis nurses must have solid practical skills and extensive knowledge of kidney disease. Solid practical skills can reduce the physical and psychological pain of hemodialysis patients and can avoid some complications caused by improper nursing operation techniques. Finally, it can also improve the patient's comfort in the entire nursing process and the satisfaction of the nursing staff, which are the basis for achieving patient trust. When the nurses has extensive knowledge of kidney disease for patients, first, they can explain the purpose, content, and benefits of dialysis to them before dialysis, and explain the precautions and healthy education of dialysis to them after dialysis. Secondly, nurses can skillfully use blood-line tubers and dialyzer and can calmly resolve and respond to emergencies in the dialysis process, improve the patient's sense of security, control and stabilize the condition, reduce the occurrence of complications, and protect the patient's quality of life. For nurses, first, they can enhance their self-care ability during the dialysis process to avoid occupational injury. Secondly, having extensive knowledge not only can better care for patients, nurses can also improve their professional level and improve the quality of hemodialysis care in hospitals.
Hello, what qualities do you need to be a hemodialysis nurse? And what communication skill do you need?
Here Wang's answer.
As a hemodialysis nurse, you should not only have excellent skills, but also have compassion, responsibility, and love. Treat patients as relatives, not afraid of dirty, not afraid of tired to give them the greatest care. For the maintenance of hemodialysis patients in all aspects, will encounter many problems, so we must do a good job in there. Psychological care helps them to establish the confidence to overcome the disease. Dialysis patients need to be very carefully with medication and care, otherwise it will cause very serious consequences. So when you go to work, you have to concentrate and you have to maintain a high level of responsibility to ensure the safety of the patient in several rooms. As a nurse work, we should not only relieve patient pain, but also patiently do their ideological work, communicate with them, let them believe in science and trust us. The details are as following: cultivate good personal qualities, including dressing neatly, speaking and behaving properly, sitting up and lying down. Everyone should take the initiative to greet patient every day. Treat patient with respect, no matter rich or poor, high or low. More respect for caregivers, cleaner, and other team members who are easily neglected. Listen to the patient inner voice and help solve the problems when they are found. Put the care into practice so the patient can truly feel being cared for. Therefore, the activity of one pendulum on stick, one sport was carried out. This is put a pendulum after the sleeper helps them pick up large orders. Give the patient a hand from a bed.
As a dialysis nurse, what care necessary for the patients? Here is Belle answer. Okay, I'm answer. I think there are 4 paths to nursing, including general nursing, diet nursing, drug guidance, and physiological nursing.
Maintenance hemodialysis in patients with renal failure requires persistent treatment operations, medical equipment, and medical personnel. At the same time as suffering from many other aspects of disease. As an excellent hemodialysis nurse, she should carry out people-oriented nursing management and nursing measures for patients, including general nursing, diet, medical guidance, and physiological guidance. To be specific, general care keeps the patient local, clean and dry, change dressings every day, prevent infection, keeps the purulin open, do not force or bend when removing puncturing needle after dialysis, and do not wear clothing with tight cuffs. Strict aseptic operation closely observe the changes of vital signs, observe the blood flow, blood pressure, dialysate flow, temperature, concentration, and other indicators. Diet care. Patients eat high quality, low protein, low salt, low sodium, low phosphate, low potassium, high calorie. Drink protein intake to 1 g 1 kilo per day, such as eggs, milk, fish. A low-salt diet is good for blood pressure control. Low-sodium diet. Daily sodium intake should be 3 g. Patients with high potassium levels are more likely to suffer cardiac arrest, so eat less potassium, such as watermelons, bananas, and animal nuts. Phosphate is one of the toxins. To minimize phosphate intake, appropriate compulsory vitamin injects penetrate fib, mental defects, obstetrician to be able to increase toxin education. Track care antihypertensive drugs, calcium agonist, antinomial drugs, EPO, vitamin C. Metabolism of calcium and phosphate active vitamin D. Phosphate binder use aluminum salt, calcium carbonate, calcium actate, and other phosphate binder. Insulin, special drugs, aspirin, digoxin. Physiological nursing. Nurses with constant experts, open-minded attitude, popular language, simple physiology and communication with patients to help patients to remove stagnance. The patient's questions must be patiently answered and feel removed. Great quiet, clean and comfortable treatment environment for the patient provides emotional support to patients to minimize pain so that they can gain a sense of security and trust and actively cooperate with the treatment, stressing inspection and communication to increase patient's sense of security, do a good job of life care patients, close attention to the patient, improve the patient's family support, improve the patient's quality of life, promote the patient's mental health. Okay, This concludes the section on nursing interventions.
As a hemodialysis nurses, what does health education for patients include? Here is Daisy's answer.
Rest and exercise instruction. Exercise therapy is an important rehabilitation. It's a systematic and planned treatment measure aimed at improving the patient's physical function and mental state. The forms of exercise include whole body nutrition exercise, equipment assisted muscle strength exercise, breathing and adjustment exercise act. Long-term HEMODIALYSIS. Patients can strengthen their physical fitness through regular exercise and strengthen physical exercise, which can improve their fatigue and weakness. Eventually, they can return to society and be competent for daily life purpose of work. Exercise should follow the principle of step by step to avoid excessive physical exertion. Pay attention to measuring blood pressure and pulse before and after exercise. If there are symptoms of discomfort during exercise, you should stop exercise immediately. Patients under the age of 50 are recommended to use walking, cycling, swimming, and other sports. Patients over the age of 50 can exercise according to their own conditions. They should inform their family and patients that frequency and intensity of exercise should be maintained at least 3 times a week. Each half an hour of exercise time, no more than an hour. The patient's limb with artificial blood vessels swelled and the soft pillow was used to raise the limb to promote blood return. After the operation, pay attention to the clean and dry operation area and see if there is blood leakage. Avoid injections, blood draws, blood measurement, and extraction of heavy objects on the affected limbs to avoid affecting blood return. Observe daily the vesicular signs of infection such as redness, swelling, heat, and pain. The fistula shouldn't be used as a pillow to prevent obstruction. Don't bandage too tightly after dialysis so as not to affect blood flow. When the pinhole is bleeding, immediately press the bleeding point to stop the bleeding. If the situation doesn't improve, see a doctor immediately.
This is our group vlog. Thank you for your watching.